Thank you very much for joining today's lecture session. And I'm sorry to start in late because I have some problem, so that I need some time to be normal. Okay. So today we'll discuss about lower limb arterial system, and we need to use color Doppler. And that's why I will discuss a brief about Doppler first, then we'll go for the arterial disease in the lower limb. Okay, শুরু করব স্যার, শুরু করে দিই তাহলে। সবাই শুনতে পাচ্ছেন আমার কথা? শোনা যাচ্ছে?
জি স্যার, শোনা যাচ্ছে।
ওকে, থ্যাংক ইউ। কি খাচ্ছেন ফেরদৌস?
স্যার লকআউট
চলতেছে খাওয়া দাওয়া? Okay. Okay, let us start. So we are going to start. So our today's session is on duplex study of lower limb arterial system. So doing this ultrasound, we will need high frequency transfer. So as you know, we are going to scan in color Doppler, so that you should have a very good quality ultrasound unit that has a very good color flow and higher sensitivity to pick the flow. This is very important. So doing the lower limb ultrasound, especially in Doppler, you will need the patient should be in supine position, and his or her leg should be open from the inguinal region to the rest of the limb should be open. And it is better if you can allow the patient to wear some loose garments. That's why you can be able to scan comfortably, because you need to go up from this level, so that if there is an obstruction here, that is not possible for you to scan comfortably. So this limb should be open, and this patient should be lie down on the bed in this way, so that you can approach very easily. And transfer should be linear, and attendant should be present, maybe your assistant or or a relative of the patient may be attend during time scanning. So during scanning, we need to know some basic things of Doppler ultrasound. So when we will go for scanning, you will learn about laminar flow and turbulent blood flow. So we should know what is called laminar blood flow. Basically, laminar blood flow is the normal blood flow that is present in a normal artery. That is, there is a continuous flow present in the artery, and flow is highest velocity is present in the center of the blood vessel, and that is the laminar blood flow. Turbulent flow, now we will look for turbulent flow. Turbulent flow describes the chaotic flow patterns associated with pathology and disruption of the laminar flow. It is usually seen beyond a significant stenosis in a vessel. The sound associated with the turbulent flow is called a murmur or bruit. Sir, turbulent flow you will find spatially just beyond a stenosis. তার মানে যেখানে স্টেনোসিস থাকবে সেখান থেকে যখন ব্লাড ফ্লো হবে তারপরে গিয়ে টার্বুলেন্ট ফ্লো দেখবো। জাস্ট ইউ সি দ্য ইমেজ, this is the laminar flow here, the normal blood vessel, but there is a stenosis here, and the flow beyond the stenosis, you see here, this is a turbulence flow, to and fro flow is present. And in the color Doppler, that's why you will see different colors. You see, this is called mosaic pattern of color. Here you will see orange color, green color, blue color. That is due to turbulence of the flow. So in color Doppler, turbulence flow will define there is a stenosis proximally. Okay.
I want to write exam.
Okay, so this is a turbulence flow, there's stenosis, then sorry, this is laminar flow, stenosis, then you will get turbulence flow.
Go with Kaka.
So again, another term you will hear, that is called Doppler shift. Doppler shift basically is, just think, this is blood vessel. So blood is flowing through the vessel, so that when it will send sound beam, so it is not static. So if there is a blood vessel, there is a red blood cell here, when sound beam comes on this red cell, it will go forward, then before returning this echo, it will go further. So this is the Doppler shift, the difference between the insonating beam, that is, that beam is coming and beam is returning, the difference in between two frequency, that is called Doppler shift. And this Doppler shift, it is more than 20,000 hertz, then we'll hear sound. Just, in ultrasound we hear sound, that is sound produced by Doppler, and that is due to this reason. This is due to Doppler shift. If it is more than 2000 hertz, then, or to 20 kilohertz, the Doppler shift, then we will find sound is producing. So now we are telling about color Doppler. What is color Doppler? This is very important, because from the color, Doppler is a technology that produces color. Color Doppler is a special technology of ultrasound unit that can produce color, or that can present blood flow with producing color. That means when we are going to scan blood vessel, their flow is present. If you place color box, this is called ROI, ROI. ROI means region of interest. That means this is the region of our interest, so that the structure or the area within this ROI, it will show the configurations or informations. So we'll see the color if the flow present in the vessels. Okay, so color Doppler has a speciality, that is, it produces color where there is flow. Okay, it can detect flow producing color, and color Doppler again can determine the direction of the flow. That means towards transducer flow will be red, and away from transducer flow will be blue. So that flow in the blood vessel will be red in color, that is flowing towards the transducer. Thus you place here transfer towards the transfer, away from the transfer. So in this way we'll see red color and blue color. And most of the places in our body, the artery corresponding vein, that means if this is the superficial femoral artery, then this will be the superficial femoral vein, usually corresponding same vein and artery. So in the artery, blood flow is away from the heart, and in the vein, blood flow is towards the heart. So that always blood flow will be different in the artery and in the vein regarding the direction. So that when you will place your color box or ROI in color Doppler, then you will get different blood flow. If you get red in artery, then you will get blue in the vein, or vice versa. So that this is the technique that that will allow you to be understand flow is present. Just think, this is the artery. This is superficial femoral artery. This is superficial femoral vein. If the vein is blocked or thrombosed or no flow is there, so what will be happen? When you will place your color box, you will see the flow present only the artery, but no flow in the vein. That means you will not get any color in the vein, but you will get blue or red color in the artery. Okay, so in this way you can be confirmed flow is present in the artery or not, flow is present in the vein or not. Okay, so this is the color Doppler that can produce color in real time. So now another things,
Sir, sir, এই যে কালার ডপলারে যেটা একটা হলো গ্রিন কালার আর একটা হলো রেড কালার।
না ব্লু
তো
কালার,
এখন
ব্লু আর রেড, ব্লু রেড,
ব্লু জি স্যার ব্লু আর রেড। এখন কোনটা কোনটার ক্ষেত্রে হবে, আর্টারির ক্ষেত্রে কোনটা, ভেইনের ক্ষেত্রে কোনটা?
ব্যাপারটা এরকম না, ফ্লো যদি ট্রান্সফার দিকে থাকে তাহলে সেইটা দেখাবে রেড কালার, ফ্লো যদি ট্রান্সফার থেকে বাইরের দিকে হয় অ্যাওয়ে ফ্রম ট্রান্সফার তাহলে হবে এটা ব্লু কালার। ঠিক আছে, এখন আমি চাইলে এটা চেঞ্জ করতে পারি, ব্যাপারটা এরকম না যে ভেইনে ব্লু হবে আর আর্টারিতে রেড হবে। তবে এটা যেভাবে প্লেস করা আছে তাতে আমরা যখন যদি থাইতে দেখি তখন সুপারফিশিয়াল ফিমোরাল আর্টারি রেড কালার আসে আর ফিমোরাল ভেইন ব্লু কালার আসে।
স্যার যেটা আমরা এই যে চেঞ্জ করতে পারি সেটা তো ইসের মধ্যে, মানে মেশিনের মধ্যে
হ্যাঁ বাটন আছে, তাকে রিভার্স করা যাবে না, উল্টাই দেওয়া যাবে। আপনি যে আমরা সাধারণত যেটা করি আর্টারিটাকে লাল কালার করি, ভেইনটাকে নীল কালার শো করি যখন আমরা রিপোর্ট দিই। তো যদি আপনি দেখেন যে আর্টারিটা নীল কালার আসছে তাহলে রিভার্স বাটনটা প্রেস করলে এটা রেড হয়ে যাবে আবার।
কিন্তু নরমালি তো সেটআপ দেওয়া থাকে যে আর্টারি রেড আর ভেইন ব্লু এরকম।
নরমালি সেটআপ দেওয়া থাকবে ফ্লো টুয়ার্ডস ট্রান্সডিউসার, মানে ট্রান্সফারের দিকে ফ্লো লাল দেখাবে আর ফ্লো অ্যাওয়ে ফ্রম ট্রান্সফার ব্লু দেখাবে। Okay, now spectral Doppler. So in a spectral Doppler you will get Sydney is eating. What are you eating? Iftar. Okay, so this is the spectral Doppler. That means when this is color Doppler producing color, so you will get a spectrum just placing the sample volume. I will show you in the next slide. I have a video for you so that you will get the spectrum. This you see a tracings waveform. So a spectral Doppler, in a spectral Doppler you will get the tracings of the flow. And you see this is the baseline, this line is the baseline, and when you see flow above the baseline, this means flow towards the transducer. Okay, when you see this is baseline and this is the spectrum, a spectral Doppler, so that when you see the spectrum is appearing this line above the baseline, so this flow is towards transducer. Okay, and if you see flow below this baseline, then that means it is away from transducer. Okay, so and if you just analyze this spectrum, this corresponds with the systole and diastole of the heart. Okay, and this peak is the peak systolic velocity. When ventricles are contracting, then there is a rush of flow in the blood vessel, so that you will get very peak flow. But when it is in the diastole, that is when ventricle is dilated, then this flow becomes fall. Then you will get this flow. This is systolic and this is end diastolic. Okay, so this is called peak systolic velocity, highest velocity of the during systole, and this is end diastole and at the end of the diastole. Okay, and this spectrum you will get in color spectral Doppler, and you will get a button in the machine that is saying PW. PW means pulse wave Doppler, and that you will produce you this spectrum. Just I'm showing you the pulse wave Doppler. This is pulse wave Doppler. Pulse wave Doppler means you see, so machine is sending pulses every time and you will get flow. You see here. Unless I need to mute the image so that otherwise okay, so now sorry, sound was there. Okay, here you see this is the blood vessel. This is common carotid artery. you see this is the blood vessel, this one. You see it is anechoic because blood is present here. That's why in grayscale you will see the lumen appearing anechoic. Okay, but when you will place your color box, this one, this is called ROI, ROI. So when you will place your color box ROI, then the machine will show us the information within the box, that is ROI. So you see here, as because this is blood vessel, so that blood flow present, so that you see here it is producing color, but beyond this vessel you don't see any color because no flow is here. Okay, so color Doppler has a that is color Doppler can produce color where blood flow or flow is present. So you see here this is blood vessel, and that's why and flow is there, that's why it is producing color. But beyond this blood vessel no color is there because there is no flow here. Okay, let us see next. And this is the pulsation of the artery. And this is the freeze image, so that you see here very nice flow. Now this is called laminar flow. You see here just the big arrow in the center. That means I should go this image. This is big arrow inside and in the center. That is the flow is maximum in the center. Flow is reduced in the periphery, and this is called laminar flow. And so just go on and see this one. Now what is happening here, you see a spectrum is coming one by one, and here you see what is happening. I'm freezing this image. So here this is the blood vessel and color box is here, that's why you are getting color here, that is blood flow present. Then we will go for pulse wave Doppler. Just use PW, there is a button, press and you will get this one. You see here few things. This is one line and this is another line. Okay, and there is a space in between two lines. This is called sample volume. That means blood flowing this area will show you the information, means this spectrum. So when this blood flow through this sample volume, you will get this spectrum. Okay, and as because we know flow is maximum in the center of the blood vessel, so that you have to place this sample in the center of the blood vessel. Okay, because we want to get the maximum blood flow, so that when you will place, then you can change this with you can move with the trackball, so that you can place this sample volume in the center of the blood vessel. This is the first criteria. Then we will get information of the blood flow, because this is peak systolic velocity, this is end diastolic velocity, so that if you place the sample box or volume in the center of the blood vessel, then you will get the highest velocity. Another criteria, you see another line here, this is the another line, this is the box, this is the box, and this is another line. This is called angle, and you should maintain the angle. Means you see this is the line and this is the line. You should maintain the angle. It should be within the 60 degree. It should not be more than 60 degree. That means when you will place this box, you will see the sample volume here, and there is a line going through the sample volume, and there is another line, and this is called angle. And you should hear there is an angle, and this angle should be less than 60 degree. Okay, otherwise your information will not be correct. Okay, let us see what is happening later on. You see now this is very good. You see here this is this sample volume is larger one. This box is called sample volume. So blood flow this sample volume will give us the information, means the spectrum. Okay, and this is the angle. This angle making with this line this angle should be less than 60 degree, and this line you need to make parallel with the blood vessel. This is the blood vessel and this is the axis of the blood vessel, and you should maintain this line with the parallel of the blood vessel, and you should make it in this way. Then you will get a good report. Otherwise it will give you, this is a sample volume as I told you earlier. You can make it larger or smaller, another issue. So you can make this sample size larger or smaller. So how much it would be? It would be like this, just one third of the blood vessel. If the blood vessel is 9 millimeter diameter, so that it should be 3 millimeter diameter, that is one third. Okay. Just I told you the angle correction. You can change this line to correct the angle. You see, just you see that, you see here. Okay, you see that you can change the correction, just making the parallel. Then you will get the good. Okay. So these are the very basics of Doppler, so that that would be helpful for us to make some interpretation next time. So now we want to look about normal triphasic waveform of the peripheral artery. Normally in the peripheral arteries, especially in the leg and in the upper arm and the lower extremity and upper extremity, you will get normal triphasic flow normally. That would be just you see here, just I'm taking the images. Okay, now you see here first peak systolic flow. When there is ventricular systole, then you will get very sharp rise, and the finally end of the systole you will get peak systolic velocity here. Now here is peak systolic velocity. Then when diastole diastole starts, then the aortic valve becomes closing, so that blood flow will be falling, and below the baseline, this is called early diastolic reverse flow. This is a baseline. Below this part is the early diastolic blood flow. Then you will get another forward flow. This is called late diastolic forward flow. So you will get three phase: phase 1, phase 2, this one, phase 2 and phase 3. This is triphasic flow that is present in normal artery, especially in lower limb and upper limb. Okay. So what are the factors? And I should tell you, these triphasic flow becomes biphasic and monophasic when flow is diminished. When you will get diminished flow? Just after the stenosis. If there is stenosis present in the blood vessel, you can understand, so flow will be reduced, as because stenos part will limit the blood flow. That's why if there the reduced flow depends on how much it is reduced, depending on the degree of stenosis, and depending on this degree of stenosis, you will see the spectrum of the blood flow, whether it is biphasic or monophasic. Just with the increasing of the reducing flow, you will get biphasic, then monophasic, then that is called Tardus purpose flow. And these are the things that will tell you the severity of the stenosis. But first of all, you should keep in your mind, normally you will get triphasic if blood flow reduces due to stenosis. After the stenotic part of the blood vessel, you will get blood flow that would not have the triphasic flow, that would be biphasic. Then if the blood flow decreases further or stenosis more again, then you will get monophasic. If the stenosis again more, then you will get Tardus purpose flow. In this way, when you will get this type of spectrum in the blood vessel, then you can be understood that is blood flow is reduced due to stenosis proximally, so that you should check the blood vessel where the stenosis is present. So in this way you can identify the stenosis. So now we need to know what are the factors that influence Doppler waveform. That is I told you earlier, that is spectrum of the blood flow, that is triphasic blood flow present in a normal blood vessel, and it becomes reduced gradually depending on the reducing of the flow. So now I am telling you what are the factors that influence blood just Doppler waveform. That is a cardiac muscle contractility, you know. So if the heart muscle cannot pump well, so that output will be less and you will not get very good flow, and that would be shown in the spectrum. Aortic valve function, if the aortic valve is not working well, again course of the blood vessel, if the blood vessel has a tortuosity, that might be affecting the spectrum. And finally, peripheral vascular resistance or stenosis. Finally, peripheral vascular stenosis will give you a dramatic changes in the spectrum waveform. So that is our interest to see today. Okay, and in this way we can be able to identify the peripheral vascular disease. Okay, so now we need to check about abnormal Doppler waveforms, and I am presenting here all the abnormal waveforms that will be just helpful for us to identify. This one, A, you see here, this is triphasic flow, so this is normal, and this is the normal spectral waveform you will get in the peripheral artery when it is normal. But gradually, then if there is stenosis, then blood flow will be less or reduced. Then you will get biphasic flow. You see here, this is systole, then quick drop, and this is reverse diastolic flow, but no forward flow. So this is biphasic. Okay, and here you see in the C image, here you will see just this is again biphasic, you know, there is no reverse diastolic flow. This is called pan diastolic forward flow, means শুধু forward flow আছে এখানে, এখানে reverse diastolic flow না। এখানে কেউ কেউ মনোফেজিকও বলছে এটাকে, যেহেতু এটা বেজলাইনের উপরে আছে এই জন্য এটাকে মনোফেজিকও বলছে, বাট এটাকে আমরা বাইফেজিকও বলতে পারছি with zero diastolic flow. Okay, and this is monophasic. You see this is ektai systole ache, so monophasic flow, and this is called turdus parvus flow. Turdus parvus means you see very slow flow, that's why very slow rise and again slow down, so that you will get very high less peak, and then it is a little bit rounded peak. So because of it takes time to just get up and get down. Okay, this is for turdus parvus flow. তার মানে হলো যে যখন আমরা ট্রাইফেজিক ফ্লো দেখবো, দ্যাট ইজ নরমাল, তারপরে ব্লাড ফ্লো একটু কমে গেলে সেটা হয়ে যাবে, আমাকে সিগন্যাল দিছে 10 মিনিট বাকি আছে, 10 মিনিট পরে বন্ধ হয়ে গেলে আমি আবার এটাকে ই করব, সাথে সাথেই করব, আপনারা দূরে যাবেন না, তাই হয়ে যাবে।
স্যার নামাজ পড়তে যাব তো তারাবি
কয়টা নামাজ?
8:20 স্যার।
হ্যাঁ হ্যাঁ শিওর।
স্যার বলতেছি কি যে এটা তো একটু মানে কঠিন মনে হয়, এজন্য আজকে একটু কম পড়াইলে হয় না স্যার?
আচ্ছা তাহলে এটার পরে বন্ধ করে দিব, মানে 10 মিনিট হয়ে গেলে
মনে হয় যে একটু কম হলে মনে হয় ভালো হতো স্যার।
ওকে ঠিক আছে। So due to request from our learners, we need to close after this session, so that we will continue tomorrow from that slide where we'll stop. Okay
স্যার 7:30 তে ভালো হইবে, কালকে তাড়াতাড়ি শুরু করলে।
ওকে 7:30 করব।
নামাজ
আজকে আমি একটু সিক হয়ে গেছিলাম একটু। ওকে ঠিক আছে। Okay, so this is the normal triphasic flow, and this is abnormal শুরু হয়ে গেছে, B থেকে this is abnormal, and depends on the severity of the disease. If যত blood flow কমতে থাকবে তত তার phase কমতে থাকবে। Okay, so this is biphasic, this is again biphasic but low zero diastolic flow, and this is monophasic flow, and this is turdus parvus flow. যখন আমরা কোনো আর্টারির ভিতরে এরকম অ্যাবনর্মাল ওয়েভফর্ম দেখবো, তখনই বুঝবো যে এখানে ব্লাড ফ্লো কম আছে, তাহলে আমরা তার উপরের দিকে, দ্যাট ইজ প্রক্সিমালি চেক করতে থাকবো যে কোন জায়গায় স্টেনোসিসটা আছে, সেই জায়গাটা আমরা বের করে বলবো, কারণ সার্জনরা জানতে চায় when you will get abnormal Doppler waveform, then you will be able to understand there is a stenosis just proximal of this blood vessel. So you should check how you will trace this blood vessel and will go up and you will get a narrow part of the blood vessel and you place your colored Doppler and a spectral Doppler, and I am showing you later on. I am showing you the later on the how we can diagnose the disease. So in this way you can be able to identify the stenotic part. This is very important to find out that part because this patient will need treatment. Sometimes surgeon will just dilate the stenotic part to allow the blood vessel flow through the stenotic part, or sometimes the surgeon needs for amputation of the limb, so that he or she needs to know up to which part of the limb blood flow is better. That's why you have to identify the stenotic part of the blood vessel or the artery. Okay, so that when you will get abnormal spectrum, then you will be able to understand there is a stenosis, so you should go up. Again, just seeing the abnormality means whether this spectrum is biphasic or monophasic or turdus perverse, that will say you the severity of the stenosis. If you see there is turdus perverse spectrum, that means the stenosis is very tight, so that doesn't allow good amount of blood, so that is bad. So you have to check to determine. So now I want to tell you the ultrasound criteria for peripheral arterial disease. So we need to identify peripheral arterial disease, so that now we are going to understand what are the criteria of the ultrasound finding of peripheral arterial diseases. First, we will check in both B mode and color Doppler. In B mode, we will get some informations. Number one, that is the anatomy of the blood vessel, I mean artery. So you can check the course variant, means if there is any other variant, normal development variant, or course of the artery, whether it is normal or tortuous. Second one is vessel contour, that is if there is any aneurysm or stenosis. So in grayscale you can be able to identify the course of the blood vessel and also the contour, whether it is normal or aneurysm আছে কিনা দেখতে পারবো আমরা, যে dilatation, if there is any dilatation, abnormal dilatation or stenosis narrowing, you can be able to identify. Then wall structures, most of the time you will get peripheral vascular disease those patient having plaque, there's calcified plaque in the arterial wall. You will get plaque in the arterial wall. So that grayscale is the right way to identify any plaque or calcification present in the arterial wall. Then you will see the pulsation, whether the artery is pulsatile or not. So pulsation will tell you the blood flow present inside. Perivascular structures, okay, that is if there is any hematoma, abscess, tumor around the artery, so you can be able to identify these things too. Then we will just scan with Doppler. So what will be the finding? Demonstration of the blood flow, that is placing your color box, you can be confirmed first whether blood flow is present or not. Then flow direction, and I told you earlier you can be able to identify whether flow direction is normal or abnormal. Flow pattern, laminar blood flow or turbulent flow. So how we can be confirmed? In laminar flow you will get solid color, you will see red color or orange color, and that would be solid, no mosaic pattern is there. But if it is turbulent flow, then you will get different color mixing, maybe red, blue, green mixing. That's called mosaic pattern flow. and flow profile, triphasic, biphasic, or monophasic. With pulse wave Doppler, you could be able to identify whether this flow is triphasic, biphasic, or monophasic, and flow velocity. And from the spectrum Doppler, we can be able to measure the flow velocity also. ঠিক আছে, তাহলে আমরা এখানেই রাখি আজকে, আর 30 সেকেন্ড বাকি আছে। So we should conclude, we should stop here for today. We have class tomorrow. I'll request you, all of us will join by 7:30, and tomorrow I will just log in on 7:30 so that we can be able to complete our this session. Okay, thank you very much.
স্যার প্রপ কোনটা নেব স্যার?
High
প্রপ
frequency tensor, high
ও
frequency
জি স্যার,
high frequency ছাড়া হবে না, তো ডপলার লাগবে আর কি। হ্যাঁ, ঠিক আছে
জি স্যার।
স্যার
হ্যাঁ হ্যাঁ
স্যার
বলো।
আমাদের মানে আলটিমেটলি আসলে আপনি স্যার প্র্যাকটিস আবার কবে শুরু করবেন?
এখন আপনি যাচ্ছেন কবে? ঢাকায় ফিরে যাচ্ছেন কবে?
স্যার আমি এই তো 16-17 তারিখে 17-18 তারিখের দিকে চলে যাব ইনশাআল্লাহ।
মানে এদিকের কাজকর্ম শেষ?
জি স্যার মোটামুটি শেষ,
স্যার
মানে এটা
করোনার মধ্যে শেষ হইলেও ছাড়বে না স্যার। আমি বাকির স্যাররে বলবো, মানে স্যার কাউরে ছাড়া যাইবে না।
আরে আমার তো মার্চেই শেষ হয়ে গেছে,
ওর তো
আমাকে
ইন্টারেস্ট
ছাড়বে
আগে
না
শেষ
মানে
হয়ে গেছে।
ছাড় দিয়ে দিছে।
আচ্ছা আচ্ছা
লাভ নাই।
আচ্ছা, যেটা করতে
ঠিক
চাই সেটা হলো যে ওই তাহলে দেখি আপনার একটু রিভিউ করতে হবে, আর ডপলারটা বাকি আছে। হ্যাঁ ঠিক আছে না? তো সেটার
আর
জন্য
প্র্যাকটিক্যালগুলো কি একদম মানে পরিস্থিতি একদম ভালো হলে তারপর হবে এরকম স্যার?
প্র্যাকটিক্যালি যত পেশেন্ট কালেক্ট করতে হচ্ছে না, পেশেন্ট বাইরে থেকে আনতে হবে, এটাই তো ঝামেলা।
জি স্যার এটাই তো প্রবলেম
এই সমস্যা।
স্যার।
এনিওয়ে অসুবিধা
আমার
নেই,
প্র্যাকটিক্যাল হলে আমার ঢাকা থেকে তারপর আসতে হবে।
নিয়ে আসবো আপনাকে, সমস্যা নেই। একদিন দেখতে আসবেন আমাদেরকে, একদিন এসে আপনি 3-4 দিন থাকলে আমি একবারে কমপ্লিট করে দেবো আপনাকে, ঠিক আছে? সেটা
আচ্ছা
সমস্যা হবে
ঠিক
না।
আছে
একবারে এসে জাস্ট একটা
জি
সপ্তাহের জন্য
স্যার।
আপনি আসলে আমি পেশেন্ট কালেক্ট করে
জি
আমরা সবাই মিলে শেষ করে ফেলবো, ঠিক আছে? আর
আচ্ছা
লেকচার তো
আচ্ছা
হয়েই গেল।
জি
আর যদি
স্যার।
কোনো কোয়েশ্চেন, আর আমি প্রেগন্যান্সি প্রোফাইলটা আমি করে দিব নেক্সট, এই লেকচার হয়ে গেলেই ওটাই অনলাইনে
জি স্যার।
প্রেগন্যান্সি প্রোফাইল কন্টিনিউ করে দিব। এটা শেষ করে দিই। আপনার একটা রিকোয়ারমেন্ট
আচ্ছা
ছিল
স্যার। আর
প্রেগন্যান্সি প্রোফাইলের জন্য।
স্যার ওই যে শর্ট কি জানি ওই যে স্যার ব্রেস্ট, তারপর হচ্ছে
হ্যাঁ,
থাইরয়েড,
এটার পরে
ওই পিকচারটা তো
এই
বাকি আছে।
এটার পরে দিব। এই যে এইটা আর আজকেই করার কথা ছিল, কিন্তু ভাবলাম যে
জি
এটা
স্যার।
একটু ভালো লেকচার আছে, এটা আমি আগে করে নেই, তারপরে ওইটাকে দিব আর কি।
জি
এটা শেষ
স্যার।
হইলে রবিবারে,
এটার পরে
রবিবারে ব্রেস্ট দিয়ে শুরু করব, ঠিক আছে?
স্যার আর আরেকটা
আমি
হচ্ছে স্যার প্রেগন্যান্সিতে বা ফিজিক্যাল প্রোফাইল যেটা ওটার উপর স্যার একটু শর্ট
ও সেটাই বললাম,
দিয়েছেন।
ওইটা একটা লেকচার করব, ওয়াইফিজিক্যাল প্রোফাইল নিয়ে একটা লেকচার করব আমি।
জি
আর
স্যার।
ফেরদৌসী বলছিলেন আর 5 সেকেন্ড বাকি আছে, তাড়াতাড়ি বলেন ফেরদৌস।
জি স্যার ক্লোজ।
স্যার